Okay, so this is a report of some findings Peter Stegman and I pulled together around trying to estimate expenditures and resource needs to support children and adolescents affected by HIV and AIDS. So just the definitions here, we're talking about children under the age of 15 and adolescents all the way up to, in some cases, the age of 24. So when we analyze the data in these national AIDS spending assessments, this slide gives you a look at the totals, the total expenditure on children and adolescents that we found here, about 1.7 billion or so, and you can see the breakdown. Here you can see the distribution of this spending by source, and you can see about half of it is coming from national governments, and then another large chunk is coming from PEPFAR. When we simply look at the national AIDS spending assessments to estimate the PEPFAR share, you can see it turns out to around 36% or so. From PEPFAR's latest assessment, which is for 2021, and categorizes things slightly differently, it's a larger number, about 41% or so. And now this shows you the distribution of that spending by intervention. Again, this is for all the sources now, not just PEPFAR, as we saw before. So you can see about a quarter is for programs to prevent mother-to-child transmission. Almost another quarter is for pediatric treatment, a large slice for voluntary medical male circumcision, and a large slice for social protection programs. And this one shows you the distribution of spending by country. And the surprising thing, I think, about this chart is you can see that just 5 countries account for a little over half of all the expenditures. And then there's a number of other countries that have significant expenditures. So we've broken them out separately, but then you can see the rest of the countries in that large gray area. So if we really want to understand how much is being spent for children, it's really important that we have good information about these top 5 countries because it represents half of all the spending. This shows you the distribution by income group. So you can see that the allocation of spending by income group is slightly different, but the largest amounts are actually in the upper middle income countries. So here's a special analysis that PEPFAR did for this activity to look at their program budgets, which are not the same as expenditures, but very closely follow expenditures for PEPFAR, and to try to disaggregate the spending that goes to programs that support children and adolescents. And here you can see their disaggregation. You can see that about a quarter of it goes for care and treatment. A large portion goes for prevention of mother-to-child transmission, also for orphan and support for orphans and vulnerable children. What you'll see if you go to the Panorama website, the PEPFAR website, they have this special analysis posted there, and it covers the population 0 to 24, and it's about 1.2 billion in total budgets for 2021. We're going to be focusing most of our remarks today on the 0 to 17 population. So that's about 818 million out of this total. So that's a look at how much we're spending. Now the question is, how much do we need? This is the bar on the right, and it suggests that in low and middle income countries, we need perhaps $2.6 billion in order to achieve all of those targets. And you can see that the distribution of the funding is roughly the same, except for that additional large green area in the bar on the right, which is programs for key populations, which represents only a very tiny part of current spending on programs for children and adolescents. But as you'll show you later on, could be a significant portion of the total needs. So it's tempting to compare these 2 bars and say, well, the difference is the gap. We just need more funding. So let's take a closer look at that question. So to address this question, we've addressed it in 3 different parts. So the first one is for the biomedical interventions. This is treatment, PMTCT, early infant diagnosis, and voluntary medical male circumcision. These programs, we have relatively good data on current spending and current coverage. So what you're seeing here is that the blue bar represents current coverage, 2021 coverage, according to the UNAIDS estimates. And the orange bar shows you the target. So for PMTCT, there's a target of 95%. Globally, for all low and middle income countries, we're about 89%. So you can see that for circumcision programs and PMTCT, we're actually fairly close to the target. For some others, such as treatment and EID, we're a little bit further away. So clearly, we need additional funds to achieve these targets. But we should also recognize, and that would be $160 million at current unit cost. But we should also recognize that funding is not the only barrier. For example, increasing treatment coverage for children requires finding HIV-positive children, diagnosing them, and then getting them on treatment. And programs have sometimes struggled to find all the children that are estimated to be HIV positive. So it's not that there are children that are being denied treatment because there's not enough funding available, as much as it is we perhaps need more funding for new and innovative ways to find HIV positive children, get them diagnosed and started on treatment. For key populations, we see a large gap because current coverage for programs for key populations is only around 35 to 40% globally, although much higher in some countries. But the targets, of course, should be closer to full coverage, closer to 90% coverage for all programs. So there's a big gap here, clearly. How much of this gap is for adolescents, for key populations in the age of 15 to 17, is hard to say. We don't have good data on how this disaggregates by age group. But we've made an estimate for this purpose on the basis of, population distribution, 15 to 17 versus all population 15 to 49. So it gives us an estimate, and it suggests that there's a big barrier a big gap, of as much as $400 million to achieve these goals. But again, we need to recognize that just providing more funding by itself for services is not going to achieve these targets, because there's other barriers: political will, legal barriers, and stigma and discrimination. So clearly we need more effort around political will and legal barriers. We need more effort and probably more funding around programs to reduce stigma and discrimination. And only once we've addressed those adequately are we likely to see increases in access to services and utilization of services. So in conclusion, we do have information about current expenditures, how much we're spending on children for programs for children and adolescents, and it amounts to about 12% of total expenditures, whereas children and adolescents amount for about 6% of people living with HIV. We've achieved high coverage for some key services, such as PMTCT and voluntary medical male circumcision, but are falling short of global targets in many other areas. Clearly, additional expenditures would be needed to achieve these global targets, but we also need to recognize that there are other constraints that need to be addressed, perhaps with more funding, or perhaps simply with more innovative approaches, better advocacy, to put the conditions into place to allow us to achieve these service targets. And finally, there are some interventions such as social protection and the DREAMS type programs for adolescent girls and young women, for which there is a clear need, but we don't really yet have good global estimates of the expenditures required. Thank you very much.